enjoying the session so far, and it's been a good learning experience. We encourage you to keep asking questions as we go along. Please post your questions in the chat box. Feel free to raise your hand, and let's make this as interactive as possible. So today, day 3, we are actually going to start looking into how to perform disaggregated birth and death registration completeness calculations, and also move a little bit into how to interpret the results that we get from these calculations for policy purposes. And we will also look at how to validate the data and the results with other sources. So we have a series of, I think, 3 lectures and a couple of exercises to go. And we'll take the same approach as yesterday for the exercises, where our facilitator, Renee, will put up one question at a time, and we'll give you a bit of time to reflect, and then we'll come back into the plenary and have a discussion. And we will also continue using the Jamboard where you can post your ideas. Now, just for the benefit of those of you who are probably not able to join us over the last 2 days or missed some of the sessions, we will begin with a quick recap of some of the main points that we covered on days 1 and 2. So I will now give the floor to Renee, and she will take this from here. So over to you, Renee. Thank you, everyone.
Thanks, Sharita. Good morning and good afternoon, colleagues. So as Sharita mentioned, we will do just a quick summary recap of what we discussed the last few days. Okay. So we discussed what an inequality assessment is, and we said it was a quantitative assessment trying to assess who is being left behind in the registration of vital events with as much rigor and the best data possible. So we said it's not an exact science because we're working with administrative data, so we know that there's likely to be more errors, and especially when you start disaggregating, there's a few more flaws in the data. However, we do want a level of certainty about who's being left behind and what magnitude they're being left behind, so that we can put in place interventions to improve registration of marginalized populations. We talked about kind of a roadmap of how you might do an inequality assessment, starting from considering your national context and populations, doing some desk review, holding an inception workshop, the importance of establishing relationships with data collectors. And then we talked a little bit more in detail about interviewing data collectors, some of the questions you might ask about the data, what data you might ask about, all the important things to know to assess quality and usability. And then we discussed, once you have the data, how to look at it to assess its completeness and usability, and if it's fit for purpose for analysis. And then today we will discuss more how to perform inequality assessments and interpret the data and what they mean for policy. And then tomorrow we'll talk a little bit about how you would write up your results to make sure that they're actually used to inform interventions and improve public health and policy. We talked about kind of briefly the equation here. So we always said registered events such as births and deaths are in your numerator, and then the denominator is the best estimate of either births or deaths, depending on what you're focused on, but that we need a little more detailed information when we're doing inequality assessments. And so here we have the example of the capital, but do the administrative boundaries align between the two sources? That's an important detail. We need to make sure the age groups are the same between the numerator and denominator. And we might need to collect some more information, such as date of birth or date of registration, in order to calculate things like age. We talked about the different data providers that we might be able to investigate if they have data for our denominator. And we also talked about the different variables that we might want to consider for our national context to investigate and see what data is available for. We also discussed the how to deal with delayed registration, or how we measure registration. And for the purposes of this workshop, we'll be looking at a 1-year period for registration, so up to 1-year delay of registration, because this allows us to track how registration is improving or not improving over time within our own country and compare to other countries as well. And all of this can start to feel a bit overwhelming, but we said that because the data is often, a lot of it is not available, or sometimes it has flaws. Actually, at the end of the day, we can only work with what we have. And so what we're really looking for is subpopulations where the Civil Registry Office and Line Ministry, where they both collect the data, the subpopulation of interest, where the definitions of that subpopulation align between the two sources. And then when we actually have the data in hand, so sometimes we might not even be able to get the data, or it can't be shared. And then once we have it in hand, we'll assess the quality and we'll see if it's usable or not. And if at that point we feel pretty comfortable with it, this is the data that we'll end up analyzing. And you might start with many, many subpopulations of interest, but unfortunately at the end of the day, we often end up with quite a smaller number that we're able to move forward with. And part of that also, we mentioned the importance of documenting who's being left behind, especially for data collection, because that's very critical that we can improve better data disaggregation, better data collection, so we have a better understanding of the marginalized populations in our country. We talked about the metadata aligning and some of the different ways that maybe things that we would need to do to align them, the importance of usual residence, and some of the complications that sometimes arise with that, and what we might need to do to fix it. And then we talked about assessing data quality, trying to see if there's some patterns in our data over time, and what do we do if maybe there's some aberrations in our data that we don't expect? Are they explainable by, say, a natural disaster or other kinds of events, or is this a data quality error? And sometimes we need to investigate more. And then once we understand the source of it, we just need to document in our report what's going on. And one of the data quality issues that we talked about was looking over time and comparing our numerator and denominator sources, and hopefully we see similar patterns in the data. And such as this picture here, they align quite nicely, which makes us very pleased that they're so similar. So that's just a very short recap of what we've been discussing the last 2 days. Is there any maybe questions or comments thus far from the last 2 days before we move on to interpreting the results of our analyses? Okay, so far so good. So why don't we go ahead and we will start with today's lecture. So we're going to first start talking about disaggregated death registration completeness, our calculations, and how to interpret them. So we saw this slide before yesterday, and we're talking about how there's more detail that we need to look at. And this is just, again, to reiterate the registered events in the numerator and our best estimate of deaths in the denominator. And as we just talked about in the review, we mentioned that we are going to be looking at a 1-year delay period for the purposes of this exercise. So let's start with sex, because that's often a source of data that it is readily available. So in this example, I chose the year 2018 because a 1-year delay would have put you into 2019. But if I had chose, say, 2019, a 1-year delay would have put you into 2020, which might have caused some complications for registering deaths, particularly if the civil registry was closed or access to services were closed due to COVID lockdowns. Similarly, for 2020 going into 2021. And then for 2021, 2022 is not completed yet, so that period of delay of 1 year wouldn't have ended yet, so we wouldn't actually be able to analyze 2021 based on our definition of a 1-year delay. So I went with 2018 because this is the most recent year that theoretically wouldn't have been impacted by the COVID pandemic. So we're looking at female deaths that occur between January 1st and December 31st, and that were registered within a 1 year. And we're going to use recorded deaths from the Ministry of Health. So we're looking at female deaths from the Ministry of Health that occurred between January 1st and December 31st of 2018. And then we'll do the same thing for the males. And so I just put the results out here from, again, we're looking at our fictional country of Poplandia. So we see that female completeness is 74%, male is 82%, and combined it's 78%. So already we can see some policy implications where it looks like there is a sex differential in registration of deaths. So next we would look at age groups. So starting with children under age 1. Again, we're still using 2018 as the year of occurrence of the event. And then the different age groups we would want to look at: under age 1, 1 to 4, 5 to 9. And I have here all the way up to 90 plus, but this depends on the national context, how good the data is in some of the upper age groups, people's life expectancy, et cetera. So in some countries, you might want to cap this at 80 plus, maybe even 75 plus. It just depends on the situation. And so I looked at the completeness and I graphed it for these different age groups. Again, we're looking at 2018. And already, let me see if I, no, go back. Already we're seeing, again, some more policy implications. So we can see that those left behind are these young children, these infants under age 1. The registration is very low. And then we have this peak here, which we'll talk about this kind of shape in a minute, but ignoring that, if you start around 10 to 14, as things start to improve among adulthood, and then kind of flattens out in the older ages. So it looks like we're definitely disadvantaged in terms of the young children, which is something that we do see around the world, and it's somewhat to be expected. And then let's put it all together. And we will look at deaths in male children under age 1, again, occurring between January 1st and December 31st in 2018, divided by our recorded deaths in the Ministry of Health system to male children under age 1. And so we would do this for each age group by sex. And so if we graph these results and compare them, we have our orange line is our females and our blue line is our males. I think I have some things. Okay. So again, these are pretty close, the males and females. It looks like the females are slightly higher, but I wouldn't read into that too much at this point in time. But what we do see starting from adulthood, so around this 15 to 19 age group, all the way out, minus this little age group right there, we see the sex differential. So adults, males are more likely to be registered than females. And then I just put a little note here. We have to be a little bit cautious about some of our age groups. Fortunately, 5 to 9-year-olds and 10 to 14-year-olds are usually have the lowest mortality worldwide. They're pretty healthy. They don't get sick. They're not as likely to do crazy things like drunk driving, like some of the young men maybe in the 15 to 19 or 20 to 24. And so often there's low numbers in this age group of children. So depending on our population and our data and how far we disaggregate, sometimes we need to look at the actual counts of deaths before we start to make too many conclusions about what's going on here. And similarly with the older age group, depending on our life expectancy and how many people and how many deaths we're actually seeing here. So just as an example, let's say you only had 100 deaths in an age group, and even just 5 records maybe had some errors or something was miscoded. That's a 5%, you know, plus or minus. Maybe either side, maybe each sex had a 5% plus or minus. Now you're looking at 10%. So just a few errors can really make a big difference when you have really small numbers. So this is something that we would need to go look into our data just to make sure if it's, you know, quote unquote real or not. So next we're going to look at ethnicity. So we're in our fictional country of Paplandia. We'll look at our Indigenous population and our Marzian population using the same dates as by sex and by age. So again, we see more policy implications, and we can see that the Indigenous population has quite a bit lower percentage of death registration completeness compared to the Marzian population. And we graph that becomes very clear. So pretty much for all ages except for this 5 to 9 right here, we see quite a differential between ethnicities. So even for these under ones, it's also apparent. And it's interesting that this, let's see if there's, yeah, so it's interesting if you note here, this goes all the way up to 110%, which you can't have more than 100% completeness, right? So what could possibly be going on here? One thing might be that there's some duplicate records in this age group, or in our data set in general. So we would want to investigate that. Again, if for some reason there's low numbers and there's multiple duplicates, that can really impact, make a big change. Versus, if you had 10,000 records and 100 duplicates, it wouldn't impact it quite as much. Another thing that could be going on is the way that ethnicity is coded or collected. Maybe it's not a mandatory field in one data set or the other, or maybe the definitions don't align, or maybe, some people got coded as one and not the other, depending on the data set. So there's some work we need to do to understand what's going on here. But we can definitely see in terms of the most disadvantaged, these Indigenous infants have the lowest rate of death registration, and that there's definitely a differential by ethnicity. So if we can put it all together, data allowing, we would look at ethnicity, sex, and age. And then we would do that for all the ethnicities, both sexes, and then all the age groups. And if we can put that all together in one nice graph, the green color is the Indigenous population, the kind of orange color is the Marzian population. The darker colors are males and the slightly lighter colors are females. So again, when we break it down by sex and age group and ethnicity, it really starts to become more apparent who is being left behind. So these Indigenous infants have the lowest rates, very low rates of registration. And it doesn't seem to matter male or female, they're both very low. And then again, we have this really low drop here. So we want to investigate, is that real, or is it a data problem, or what's going on there? But then if we look at just adults kind of overall, we can definitely see that the Indigenous women have the lowest rates of death registration, followed by Indigenous men, and then Marzian women and Marzian men. So we see differentiation so within ethnicity, males are always higher than females. So the Marzian males are pretty much across the board higher than females. And then within ethnicity, the Marzians, both males and females, are higher than the Indigenous males and females. So there's a couple different things going on here that we're seeing. So to put that graph into words, what kind of the key points that we might want to take away is children under age 1 are the least likely to have their deaths registered, especially Indigenous children. And then Indigenous women are the most underregistered adult group. And both Indigenous males and Indigenous females are less likely to have their deaths registered compared to Marzians. And there are sex differentials in registration within both the Marzian and the Indigenous population. But we do need some further investigation to understand the data quality issues for Marzi and death registration. So remember, we saw that the rates above 100%. We saw that weird kind of drop in 5 to 9-year-olds. There were some wonky things going on that we want to understand a little bit better, if they're real or if maybe there's some data quality issues we need to be aware of before we draw any strong conclusions. And based on those findings, we could start to think about some policy implications and possible recommendations. So for the first one, when we're looking at low rates of infant registration, we might ask ourselves, is there a way that hospitals could facilitate death registration? Because many children in this age group often die in the first few days of life. And because of that, many of them are already still in a health facility. Maybe they were just born and they were sick and they never left. And so the death would have occurred in the health facility. So is there a way to better link health facilities with civil registration, or maybe to support grieving parents to ensure that down the road the death gets registered, brainstorming and thinking about ways that those deaths could be registered better. And then our second policy implication, we need to think about what's going on with the Indigenous populations. So is it that they live in really remote areas? Maybe they don't have access to registry offices. Do we need to build more registry offices in those areas? Do we need mobile registration to go out and reach these people? Maybe we need some target campaigns and awareness raising and advocacy specifically for the Indigenous population and especially women. So we're not entirely sure why their rates are lower, so we need to investigate that to understand what are the best interventions to do in order to improve registration. We also would want to investigate why there are sex differentials in registration, and so we could also target some women's groups, because we know that even within ethnicities, women are always lower than men in terms of their registration. Perhaps some awareness raising activities around the importance of registering deaths might help as well. And then finally, it's important that we share our findings with our data providers and go back and discuss some of these data quality issues. So why are Marzians over 100% complete in that 5 to 9 age, or sorry, in the 1 to 4 age group? Why did they drop so much in the 5 to 9? Maybe they got miscoded and there's some shift. Some of those 1 to 4 should have been 5 to 9s. Maybe ethnicity isn't coded the way it should be. Maybe some of them are missing. Do we have duplicate records? There's a lot of things that could explain this, but we need to investigate further so we fully understand. And so this particular exercise was talking about deaths, but many of these concepts or ideas would also apply to births, which we will also talk about later in the next lecture, but just note that this is not all specific to death per se. So with that, I'll take a little pause and see if there's any comments or questions from the group before we go on to our exercise. So I don't see anything yet. So we had to start a new Jamboard for today. So I think I believe Panita has shared the link in the chat, as well as the link to the exercise. So we are on exercise 5. So maybe what we can do, again, similar to yesterday, we'll pull up the exercise. We can read it together and make sure there's no questions. And I'll give you a few minutes to work on each component. And as you go through, if you're ready, you can post your sticky note to the Jamboard with your thoughts or reflections on the particular question. So let me share my Word document. Okay, so let me see if I can zoom in a little bit more. I know it's hard to see when I'm sharing my screen. Okay, so exercise 5, we're gonna read question 1 together. So Poplandia recommended the Ministry of Health start collecting data for ethnicity. This data became available in 2018. Based on the results below, what are the two main groups that Poplandia should focus on to improve death registration completeness? What would each of these groups have? Would each of these groups have similar policy interventions, or are they different? Explain your thoughts. And so here's the figure below, and should look familiar, similar to what we just saw in the PowerPoint slides. So have a look at this and have a think. If you could only have two key takeaways, who would you focus on and why, and maybe what are some of the policy interventions? And we have it set up on the Jamboard, so let me share that real quick. Okay, so the first slide here we see on the Jamboard. So who are the two main groups? If you want to just post your ideas here, who you would focus on. And then maybe you could post some answers to the question over here, the second part. Would each of these groups have similar policy interventions, or would they be different? So maybe have a think about the graph and what you see in the data, and then we can circle back and discuss, and I'll give you, say, 5 minutes or so, and then we'll go on to the next question. Jamboard link with page number. Maybe Panita, can you put it in again? We had to start a new Jamboard, so we're just on the first slide of the Jamboard for today, because apparently you only get 20 slides and we filled them yesterday. Okay. I don't see any stickies yet. Maybe people still need a few minutes. I see that some of you needed the link again for the Jamboard. So maybe in the next minute or so, if you can post at least who you think maybe should be the focus. If you could only choose 2 groups or populations, who would you focus on? Okay, so I see a number of you have started to post. And there's a few different answers. And, a comment from our colleague says, yeah, it's a tricky question. And it is. It doesn't, there's not always necessarily a right answer. And a lot of it also would probably depend on context and the research you might do. But what I was looking for, what immediately stands out in the data? And so a lot of you have identified that. So the Indigenous females, especially the adults, are much lower than everyone else. So that might be your first point of intervention, is trying to improve death registration among Indigenous females. And let's see, what else do we have? There's children 5 to 9. Yep, other people commented on the 5 to 9. Yep, okay. So yeah, that I think, and then these groups would have similar policy interventions, both groups with similar policy interventions. So let's have a look at the graph again. Go back to the Word document. Okay, so here's our graph again. And yes, if you look at this, at these 5 to 9s, these are the absolute lowest of everyone. So if this data is real, then yeah, you probably would want to focus on these children, figure out what's going on. I personally would probably look at these Indigenous infants, because I think there's a problem with the data, because this is too high and this is too low. And my first instinct is that some of these 1 to 4-year-olds perhaps are actually 5 to 9-year-olds, or something is wrong with the data. That was my first instinct. Usually we don't see this kind of shape in death registration by age. But I'm a little bit biased, having worked with data like this for many years. So I was interested in the infants, and then of course these Indigenous females, which all of you also identified. So let's say that either we looked at the children or the infants, and then we looked at the females, but they might have different policy implications. So as we mentioned with the infants, often infant deaths occur in the first few days of life. They're kind of skewed in that direction. So yes, they could occur anytime in the first year, but if you looked at a graph of what day and time infant children died, a lot of them are kind of shifted more towards the birth period. So some of them might still be in the hospital at death, and maybe capturing those would be less complicated than some of those that died later at home. And so having some way to link those deaths to the civil registry system might be one easy, quote unquote, easy intervention to make sure that we capture those deaths. Versus Indigenous women, they may or may not be in a health facility. They might die at home, perhaps road traffic accident deaths, or those kind of things out in the community. And so capturing them might be a little more challenging if they are not in the facility. The fact that it looks like there is a sex differential, so gender is playing into this, and then also ethnicity is playing into this. Those probably have policy implications as well. And so whether it's that this ethnicity lives in remote areas and doesn't have access, maybe there's some cultural awareness issues, or maybe this particular ethnicity is fearful of the government because they've been persecuted in the past, and so they're fearful to go register vital events. There could be a number of reasons that we see a difference in ethnicity. And so because of that, each of those would have different policy interventions. So, and then the final thing I just wanted to point out is there, in some cultures, inheritance goes through the male lineage. And so if a woman dies, there isn't really necessarily an economic incentive to register that death, because maybe her husband or then her male children or whatnot own the property. And so in that case, it's more of, there's almost like a cultural shift that has to come about in terms of improving gender equality and maybe access to property or inheritance or whatnot. And so there's some of these like socioeconomic factors that could also be playing into the sex differential of why some, the females are registered less than the males. So that might be like a longer term kind of broader social cultural intervention and have policy implications. So let's go on to our next question. And this is also death registration. So upon completing the analysis of death registration completeness, Poplandia finds that death registration completeness for Marsian children aged 1 to 4 is above 110%. So we saw that here. It's quite high. And we know that above 100% is not possible. It's nonsensical. It doesn't make sense. There's something wrong with the data. So have a think, and we talked about it briefly in the lecture, but what are 3 reasons that this number here could have resulted? How could we have gotten to 110%? So list 3 reasons why you think what may be some of the issues with the data or what could be going on here. So I'll give you just a couple of minutes to think about that, and we'll go on to the next slide on the Jamboard to post your thoughts. And I'm going to have a look at the comments too.
Gula nói chứ được. Gula ya. Cái twist nó masuk.
While we're having a look at, so I see, I think, I believe our colleague from Thailand's hand is up. Did you have a question or comment? Vishan, did you have a question or a comment? I see your hand is up. You were on mute. Okay, go ahead.
Yes. Could you go back to the picture in the exercise 5?
Go back to the picture of number 1 or number 2?
Yes, number 1.
Okay, sure. Give me 1 second. Okay, yeah, this one.
In the case of the date completeness is over 100, how do we explain to this situation, and how should we do for the data of date?
So that's what we are working on. Number 2, the question number 2, right? Is like we're looking at, again, why this could be, yeah. So I want you to have a think about it, and then we'll talk about why this could be. So there's many different reasons, but we'll definitely discuss this. But do you have any thoughts? Maybe what's going on here?
Okay.
Have a think. No pressure. And then post your thoughts to the Jamboard, and we'll talk about some of the reasons why this could happen.
Okay, thank you.
Of course. And then I also saw a comment from our colleague from Rajasthan. Do you want to elaborate a little bit further on your comment from the chat box?
Ma'am, I was just, am I audible, ma'am?
Yes, I can hear you. Go ahead.
Okay, ma'am. In fact, it was just a comment. I just wanted you to confirm whether it's right or not, because when you talked about the cultural differences in registration and where inheritance is and succession are not in the favor of the females, there the death registration is very low. What I wanted to say that if all the cases of deaths, occurrences of deaths are registered in the hospital compulsorily, mandatorily, so that will rule out this cultural differentiation.
Yeah, so that would be one way to work towards it, right? But then you would also have to consider the deaths that occurred at home. And so if those deaths, if they don't come in contact with the hospital system, then they might be left out. So we'd have to factor in how to do that. And in many countries, death registration is mandatory, in which case you often do have to go to the hospital system and get your notification of death. But for whatever reasons, people just aren't doing it, and it's not enforced. So yeah, it definitely would help if you died in the hospital, you recorded in the hospital, to link that and compulsory share that with the civil registry. That definitely improves some of the data quality and issues there. Yeah. Just check, was there any other comments or questions? I'll give you about 1 more minute maybe to post some of your brainstorming ideas on the Jamboard, and then we'll discuss some of the different ways this could have happened. Okay, so a number of you have posted your thoughts on the Jamboard so far, and I see that a lot of you have mentioned duplicate registration, and so that's a big factor. So that would be your first, perhaps, red flag. You know, why we are seeing over 100%. So if you have a death registered, the same death registered more than once, then that would artificially boost your registration completeness, right? Let's see what some other, so we have some incorrect entries of data. Yep, so that's probably also a consideration. Delayed registration. So I'm not sure. I see a couple of people mentioning delay. Maybe someone could elaborate on what they're thinking. Residential status issues, delayed person. There may be some duplicates underreporting. Yeah, so underreporting in the denominator. Yep. So if your denominator is too low, then your estimate gets inflated more than what it actually is. And there might be some definition difference. Yep. Includes foreigners or not. Oh, yeah. So Thailand's comment about foreigners, again, that would play into our definition. So if our definitions don't quite align or something is off, that's definitely going to factor into our numbers and our numerator and denominator. Age heaping in the border, ages, lack of registration. Yep, so there could be some age miscoding problems. Okay, data entry, duplicate register. But does anyone who mentioned delay want to elaborate on that a little bit more? Tell me what you were thinking. Any brave volunteers?
It might imply that the deaths which occurred last year would not be registered, and the deaths of last year and of this year are registered in this year.
Okay, so yeah, so if we're giving it a 1-year delay period, but what you're saying is maybe there's some errors in the data. So they should have been for last year, but they didn't get them in the right year, so they lumped them into the wrong year. Yeah, so that could be part of the problem. That could be an error issue. That makes sense. Yeah. Okay, so let's. I'm going to go back to our Word document, and we can have a look at some of the things that could possibly be explaining this. So it might be, again, helpful to, here's our little equation that we're looking at just as an example. So everyone, I think, identified the issue of duplicates. It's quite possible that there's duplicate records, and so we need to check that. And then if there's duplicates for this age group here in the 1 to 9, I would be also worried that maybe there's duplicates for other ages. So we would want to kind of check across the board if something is going on. Another possibility, and I think that Philippines mentioned this in their sticky note, is that the denominator, so here are recorded deaths from Ministry of Health. Maybe they didn't either get all deaths or they didn't accurately record ethnicity. So the problem here is with the Marsians. So maybe the civil registry on the top, they got all the Marsian deaths, no problem. But for whatever reason, maybe there's some missing, maybe all the deaths are there in Ministry of Health, but some of the records are missing ethnicity. So say 25% of your records don't have ethnicity, and then they got excluded from this denominator. So that's artificially going to boost up your completeness, and that could push you above 100%. So it could be something about missing records or the way that they coded Indigenous versus not. It could be something going on with your Ministry of Health data. And then conversely, the civil registry could have erroneously recorded ethnicity as Marsian. So maybe in your numerator, you have too many deaths coded as Marsian in your civil registry, when actually they should have been other ethnicities or other ethnicities. And so that would make your percent go too high. And then again, if you're, for some reason, the definitions didn't align, maybe they factor in what a Marsian is differently, then that could also impact the quality of your data. And then the final thing I would really, especially for this, 1 to 4 is not so much, but if it was the 5 to 9, I would particularly want to look at the number, the actual count of deaths that you're looking at. So as I mentioned before, if there's just, say, a few errors in the records, then that could artificially skew the data above 100%. So again, if you only had, say, 30 or 50 deaths in this age group, and there were 5 records that had errors, that could, change things by, say, 20% or whatnot. But if you have 10,000 records in this age group, then it's not likely that that's the problem. So you want to look at the actual count of deaths that in this age group by to just understand what's going on, if maybe that's a factor. And then, as our other colleagues from India mentioned, maybe there's something going on with delayed registration. So again, here's our equation. We're supposed to be looking at deaths that occurred in 2018, but maybe some deaths from 2017 got miscoded somewhere along the line. And so maybe the civil registry put them into 2018, even though they weren't. And so that would have also increased our completeness above 100%. So it's definitely a data quality issue. There's some kind of error going on, but there's a number of places that it could be coming from. So we need to investigate further which one of these it is. What is the full name of CRO? That was the abbreviation for Civil Registry Office. That's a question in the chat. Any questions or comments on this exercise question? Let's go to the next one, because this kind of builds on this completeness. So here's another figure below. And does this figure below support that there may be a problem with your ethnicity data? So, we're looking at the completeness again from above, and we think one of the factors might be the ethnicity data. And if you look at this graph, does this also support your finding that there might be a problem with the ethnicity data? Why or why not? So we'll go on to our next Jamboard slide. I'll just give you a couple of minutes to post your thoughts. maybe it would be also helpful. Let me give you a little hint. You'll see on the graph that there's a blue horizontal line. And if that blue horizontal line is roughly 100%, around the 100% mark. So have a look at the graph and notice, is anybody else over 100%? And if so, who? Okay, I see a number of you have posted comments, and with the hint, I think we're onto it. So when we look at the figure, and we see this kind of line here, this is the 100% mark, right? But this is not the only category above 100%. We see some issues here, even here, you know, slightly here. So even though it's maybe just a little above 100%, we know completeness can never be above 100%. So something is not quite right. And mostly we're seeing this in the Marsian males, but we see this a little bit with the Marsian females too. So this would support the fact that there's probably something going on with the ethnicity data that we need to investigate. So whether it be there's missing records in the denominator from Ministry of Health, whether it be there's miscoded, perhaps too many records from the civil registry in the numerator, maybe they miscoded people as Marsians when they weren't. Whatever it is, it requires some investigation before we can draw too strong of conclusions, and to also understand perhaps the extent of miscoding or missing records. So this is just to say, yes, it strengthens our claim that something is probably wrong with the ethnicity data. Any questions or comments on that before we go to the next question? Okay. Oh, I thought there was one more question, but I guess that was the last one. Okay, so that's it for deaths. We are at 10 o'clock. I think maybe what we'll do is we'll go on to lecture 11, And then maybe we could have a little break and then go on to the exercise after that, if that sounds good to everybody. Go back to. Right, so I will share the slides again. We just completed exercise 5, so now we are on lecture 11. Okay. So now we're going to look at birth disaggregation completeness calculations and how to interpret them for policy. And I'm just going to mention survey data briefly here because I know a number of you mentioned that you had a mix or a DHS in your country. So there's likely that there's some analysis that's already been done for you. So you don't necessarily have to do the calculations, but it's helpful to look at the data and to have a think about it. So I just went to go look for at the DHS website in the Asia Pacific region who had the most recent one, and Bangladesh came up as one of the ones that looked at birth registration completeness and was fairly recent. So there's this really nice figure here that's color coded by percent of children under age 5 who've had their birth registered. And you can see that this, I'm going to totally pronounce it wrong, but Rajshahi, the province here it's half as much as the Sylhet over here. So while Sylhet is still low, you know, probably barely more than 1 in 3 children, this is the lowest in the country. So there's something is going on here that probably people are even more disadvantaged. I am by no means an expert in Bangladesh. I'm not sure about the geography or the situation. Maybe our colleagues could comment more. But just wanted to point out some of the interesting things that I found in the table. So it looks like there isn't really a difference by sex. But what I found interesting is there wasn't really a difference between urban and rural. So urban is 26%, rural was about 25%. They're very, very close, which is interesting because that tells me that it's not necessarily that people are living in remote areas without access. Maybe people in urban areas don't have access as well, or maybe something else is going on. Perhaps there's some barriers to registration or awareness issues, maybe all of these things, you know, I'm not sure. Again, our colleagues could comment more. But I find this very interesting that they're very similar between the urban and rural, which means that we wouldn't necessarily, you know, that has different policy interventions than if we saw a really big disparity between urban and rural. And then the other thing that is interesting is the lowest wealth quintile has the lowest percentage, which we might expect. And it's about 10% lower than the highest wealth quintile. But it's interesting that those kind of in between are clustered pretty close together. And it sort of gradually increases, that, you know, kind of jumps around or whatnot. But, you know, maybe because registration rates are low, that maybe this doesn't play into it as well. But you know, if you were a country that you saw quite a bit of differential in wealth quintiles, then maybe you would want to look at the, you know, if the lowest wealth quintile had lowest rates, that's where you would target it. If for some reason you see a really big differential in rural areas versus urban, you might need to think about access or you know, mobile campaigns or whatnot. So all of these things would play into how you're going to frame your recommendations to policymakers to improve birth registration. So we kind of talked about some of these things, but you can look at the data from the DHS and just have a look and see what subpopulations that are being reported have the lowest rates. And then have a think about your country. Do you know what the root causes are? So why does one subpopulation have a lower registration than another? Is it an access issue? Does it have to do with cultural practices, or maybe certain populations are fearful of the government? Is there a lack of awareness or other barriers, such as maybe there's a cost not just to register, but to take a minibus all the way into town and to stay there? you know, there's the time factor or whatnot. Perhaps you require some kind of documentation from both parents, or, you know, it's hard for single mothers, or you need a marriage certificate, which even if you are married, you maybe don't have the actual document for whatever reason. So there can be a lot of things playing into low birth registration rates. But it's also okay to say you don't know. So maybe you see low rates in a certain population and you're not entirely sure why. So part of this inequality assessment is just documenting what you don't know and what areas need more research. And it's okay to just say that, you know, maybe we need to do some focus groups or some outreach, or even some more desk reviews or whatnot to understand what's going on in these communities and how we can improve registration. But if we do know, or we have a pretty good idea, our next step would be to determine what interventions would need to be put into place to improve registration in these marginalized populations. So we talked about really briefly in Bangladesh, in that example, the urban versus rural, it doesn't seem to have a big difference or a large impact. So it would seem as though there's other factors playing out besides the remote access, or maybe that there's just low access across the board. So I'm not sure, but it seems like a little bit more investigation would be needed. When we don't have a DHS or other surveys, and then we need to do our own analysis. We are going to look at, again, our fictional country of Poplandia and birth registration completeness, and we're using the year 2019 because we're going to use the Ministry of Education data as our example. So just give me one quick second here. Oops. Okay. We said that, you know, we kind of talked about before, the most recent school enrollment year was 2021 that we would have data for. And so where maybe those in kindergarten aren't completely, it's not compulsory, or they go to private school. So we'll look at grade 1, and that puts us back, you know, 6 or 7 years or whatever it is to 2014. And so that's even though it's a bit dated, like, this is the best that we have in this situation. So this is what we're going to work with. And again, we're going to make the assumption that our country has zero migration, because that would affect those. We have to think about those reverse survivals. And if there's a lot of migration in our country, that assumption isn't going to work for this kind of model. Let's see. So what we are going to do, we also kind of talked about, we want to query the Ministry of Education database by the birth date of the children. So we'll query by 2014. And then we're going to try to find infant and child mortality estimates for the interim years between 2014 and 2021, and to estimate the number of children who have died in that period. So our numerator is going to be the registered births that occurred, the births that occurred between January 1st and December 31st in 2014 that were registered within 1 year. And our denominator is, so we're using 2021 school enrollment data, but we're looking at children whose births occurred in 2014. And then we're going to add them to our estimates for those who died in the 7-year period. So we're thinking about everyone from 2014 to 2021, all those children who never made it to school because they died. And that's our denominator for our births. But when we're thinking about the infant and child mortality, there's a few factors that we need to consider. So, you know, we reverse survive those who had died to make sure our births are complete in 2014. But because it's an inequality assessment, we're looking at things like the sex of the child, or the age of the mother, or ethnicity, or residence, or whatnot. So we want to also distribute these reverse survived children by these factors, because it's more than likely that perhaps that certain regions of the country have higher infant mortality than others, or maybe one ethnicity is higher than the other. And so we can't just kind of equally say we need to think about this a little bit more in depth in terms of those children were quote unquote reverse surviving. so, you know, the methodology and kind of the statistical process of reverse survival and the software and all that stuff is a bit outside the scope of this workshop, but you know, just as an example, it's good to think about the kind of different data sources that we would need to do, and also the redistribution, because this would apply to other things, say if you had blank records or whatnot. So if we don't know our infant and child mortality rates by ethnicity, which in many countries you might not have, you might just have a national level estimate, then we would need to distribute those estimated deaths using other sources. So if maybe you have a census or some kind of survey or something that can maybe tell you at least what percentage of the births are Indigenous or other, or you know, that at least is helpful, so you can kind of split things up, but then you're assuming that the mortality didn't you know, doesn't have any kind of differential. So whatever information that you can have to kind of have a little bit better estimate in terms of this mortality and how it affects different subpopulations is good and important. And again, we're doing the best we can with the data that we have, but we are trying to be a little bit more rigorous. So in this case, for the birth registration, we'll do something similar to the death registration. We'll just start with something simple by sex, because that's where often the most data is available. So if we look at male babies born between January 1st and December 31st in 2014 that were registered within a year, and then we are looking again at school enrollment data, but this time just for male children that were born in 2014. And then those male children that died in the 7-year interim period. And so let's say that we get 90% completeness of births for females, 92 for males, and 91 for both sexes. So there's a slight differential. But then how, you know, we can't, I wouldn't read into it too much, because how many of our records are got changed when we did that reverse survival, or could our, you know, the way that we did our redistribution could have made a slight difference. So I think we need to dig a little bit deeper. If it was a very big difference, say like 90 and 80%, then I think that would pretty clearly show that there's probably something going on. But within a couple of percentage points, it might be hard to draw a conclusion with imperfect disaggregated data. So next, let's also look at the age of the mother, because there is some evidence that younger mothers are less likely to register their birth of their children. So in this case, we're looking at mothers aged 15 to 19 who gave birth between January 1st and December 31st of 2014. And then school enrollment data, again, to mothers. So this is the age of the mother at the time of birth from the school enrollment data, 15 to 19. And then we're from the children who died from when their mothers 15 to 19 who had children, but they would have died in the 7-year interim period. So we're factoring those in as well. And the mortality rates based on mother's age might be challenging, so you might have to make some assumptions and do some redistribution here. But we're just, you know, as long as you can document what you did, so people are clear that there might be some caveats to consider. So let's say that this is our result, and we're looking at birth registration completeness by the age of the mother in 2014. And so one of the first things that we see is that there does seem to be a differential for younger mothers. The rates are lower. They go up pretty high, and then as mothers age, they start to go down again. So we do see for very young or very older mothers that there does seem to be a differential in birth registration. And then if we start to look at the mother's age by the sex of the child, so, you know, are young mothers more or less likely to register a male versus female, or older mothers as well? And so if we look at that, it does seem like perhaps the young mothers, there's a little bit higher registration for the males here too. And then the same with the older mothers, there's a little bit higher male registration compared to females. But in these interim ages, they're very close. So let's look at ethnicity. And so at first we would look at just the Indigenous births, and then school enrollment data for Indigenous children, plus those Indigenous children we estimate to have died in the interim period. And if we come up with the results and we see that 89% of Indigenous children are registered compared to 99% of Marzians, then already we're seeing policy implications. So this is a big enough of a gap that we can feel pretty confident there's probably something going on. So let's say that we look at mother's age and ethnicity. And then we can start to see that there's a lot more differential, especially in these younger ages. So if you look at the Indigenous population, only 60% of teenage mothers registered their birth compared to 93% of Marzians. And then for the young mothers, 20 to 24, 70% of Indigenous compared to 99% of the Marzians. And we can see across the board at all age groups, the Indigenous has lower rates than the Marzians. But the differential is the biggest in these young mothers here. And so, you know, we would look at mother's age by ethnicity and sex, but we are going to do that as part of the exercise going forward. So going back to those young mothers, we see that they're less likely to register their births, but is it possible that there's something else going on? So think about young mothers and also perhaps marital status. So if we look at young mothers by ethnicity and marital status, the results also all of a sudden become even more interesting, because if you look at Indigenous married teenage mothers, that birth registration is actually quite high. But if you look at the non-married Indigenous teenage mothers, it's almost 50% lower, it drops to 50%. So there's a very big differential, even within ethnicity and teenage, just based on the marital status. And then we see a little bit of a differential for Marzians as well. So 99% of married Marzians teenage mothers register the birth compared to 85%. And then we see something similar with young mothers aged 20 to 24. Again, marriage seems to increase birth registration among the Indigenous population compared to non-married mothers. And there's a little bit of a differential among Marzians, but it's not quite as big as the teenage mothers. So we want to ask ourselves why this is. Is there perhaps a legal deterrent? Is a marriage certificate required to register a birth? Is the father required to be there? Is there some kind of, you know, limiting factor, at least with the ID or paperwork? Or is it societal stigma? Are teenage mothers, you know, too afraid or embarrassed to come in to register their births? Or maybe they're not as aware as the older mothers. So we need to understand some of the factors that could be playing into this in order to improve this registration among this population. Oh, and then other factors, you know, such as education. So if you're a teenage mother, perhaps, you know, you didn't make it all the way through school, you might be more likely to be impoverished. You know, a lot of other things could be going on. So some of these other factors could be playing into registration. So next, let's look at geography. And again, we like to look at usual residence if we can, but we'll have to see what our data allows us to do. So let's say that both the Ministry of Education and the Civil Registry Office collect provincial level data. However, the Ministry of Education data is for school location. So they don't have the usual residence, but they do have the location of the school. But the Civil Registry does collect usual residence. As people are likely to go to school close to home, we'll use school location as a proxy for usual residence. And especially if we do our analysis at the provincial level, this is less prone to error. So people might move within a province, but even if they move, say, district to district, it doesn't affect our analysis too much because we're looking at a provincial level. If we did look at, say, district or even division levels, we might run into more problems with this proxy and people kind of moving around between, say, birth and school enrollment. So again, if you recall our lovely country of Poplandia, And we have our provinces here. So we have the capital, Capitalville. There's a lot of people living here, a lot of people living in the Western province. Perhaps the Midwest isn't quite as populated. We have the Central province, the Eastern, which is more remote and sparsely populated. Again, Eastern Isle, your Mid Isles, and your Western Isle. And now let's think about where our civil registry offices are. So there's a lot in the capital in the Western province. There's some down here in the Midwest province. There's one down here in the Central, and there's one up here, you know, in theory, maybe to kind of service if people came over from the island. But there's only one for all the Mid Isles and one for the West Isle. There's none in the Eastern Isle, and there's none in the Eastern province at all. So we can already see just by looking at this map, the access is probably going to be an issue, because if you live in this remote Eastern province, there's not even one registry office in your entire province. You would literally have to go to another province to register the birth. And the same with the Eastern Isle. If you're out in this outer island, you would have to take probably a bus, or sorry, a boat, and then a minibus in order to register the birth. So this is quite prohibitive for these people in remote areas. So we do our analysis. So our numerator is those births that occur in the Eastern province. Again, we're looking between January and December of 2014. And then we're looking at school enrollment data of the Eastern province. And then those children estimated to have died in the Eastern province in the interim period. And if we look at birth registration completeness by province, we're not too surprised perhaps that we see the capital is quite high, and so is the Western province. There's lots of registry offices. But then as you start to go over to these remote areas, the Eastern Isle and the Eastern province that don't have any registry offices, rates decrease quite significantly. So this Eastern Isle is almost half of what the capital is. So, you know, obviously not having any registry offices is going to impact your completeness. But we want to know like a little bit more information. So if we know that the majority of the population in the East, let's say that we know the majority is Indigenous, we would ask ourselves what is a, you know, obviously not having a registry office is going to impact registration, but how much does the ethnicity, perhaps cultural practices or awareness or whatever else might be going on, how much is that also impacting it? So is everyone in the East being left behind equally? Do we see 65% registration among Indigenous and Marzians, or is there a differential also within ethnicity? Because that means that there might be some other factors going on. And we'll look at this again as part of our exercise, but it's just something to think about. So similarly for the Eastern Isle, is everybody living there, low registration, say around 50%, or do you see, say, Marzians at 80% and Indigenous at 20%, in which case you probably have both your remote access issue and maybe some cultural issues going on as well. And the reason that we want to know this is because that means there's different interventions that we'd likely have to put in place. So you could build a registry office to help improve registration, but you might also need to do some advocacy and awareness, you know, to those different ethnicities to make sure that the differential between them, that you bridge the gap. So similar to the death registration, looking at our findings, we'll just do a summary of what we've seen so far. So young unmarried Indigenous mothers are the least likely to register their births. So we saw only 50% registration among young unmarried Indigenous mothers. Young unmarried and Marzians are less likely to register births than their married counterparts. Those living in the eastern part of the country, especially the Eastern Isle, have no registry offices and are less likely to register births compared to other provinces. Across all ages, Indigenous mothers have lower rates of birth registration compared to Marzian mothers. Younger mothers and older mothers are slightly more likely to register a male child compared to a female child. And further investigation is needed to understand the impact of things like poverty, education, and the intersection with age, ethnicity, and geography. So a lot of those things also have some policy implications. So the first thing to do is to ensure the law does not prohibit registration by, say, single or underage mothers. So perhaps there's some law that, you have to be 18 to register a birth. Also, we want to educate our registry staff so that young single mothers do not experience stigma when registering their births. And it might be necessary to seek out young single mothers, especially Indigenous mothers, in terms of targeting them for mobile campaigns and outreach. In terms of our geography, we might want to work towards building registries in the eastern part of the country. So perhaps we set a goal or a metric such that, X percent, say 90% of the population lives within 10 kilometers of a registry office, or whatever's feasible given our budget and resources. And in the interim, we'd probably want to increase the number of mobile campaigns in those areas so that those populations are being serviced. We want to investigate why we might see sex differentials in registration among older and younger mothers, and then target these groups for educational campaigns around the importance of registering both male and female births. And then finally, similar to deaths, it's important that we share our findings with data collectors and discuss any possible data quality issues that we found along the way or any variables that aren't being collected, so that we can improve data collection for our future inequality assessments. So one example in this case, it might be good to discuss with Ministry of Education if they can start collecting usual residence data instead of having to use the school location as a proxy. So we'll pause there. Let's see. Okay. Any questions or comments thus far? We're right around break time. So what I suggest we do is maybe take a 10-minute break, and then when we come back, we can start on exercise 6. And if that sounds good to everyone, maybe Panita can put the timer up and we'll reconvene in 10 minutes. Thanks, colleagues. kind of me. Policy intervention on compulsory primary education and school enrollment tagged with birth certificates. It may surely increase the birth registration. It may also address the issue of registration of children of single mothers. Just a thought. And so this is a really interesting thought, and I wanted to just touch on the partnerships and importance of Ministry of Education. So compulsory birth certificates are great as long as they aren't actually compulsory. And what do I mean by that? What I mean is we want to make sure that we don't increase barriers to already marginalized children in terms of accessing school. So if for some reason they can't get a birth certificate, we don't want to prohibit their education based on that, right? But there's some really great examples, and Vanuatu, I believe, is one of the countries that comes to mind, that there was a really strong partnership between the Ministry of Education and the Civil Registry. And so in theory, they made birth certificates compulsory to enter school. But how that kind of played out is that as children were going to enroll in school, they could see who didn't have a birth certificate, and they were able to support those children and those families to link up with the civil registry and acquire birth certificates. So it was compulsory, but they supported the families to get one, to make sure that everyone had one. And so I believe some of the ways they did that is maybe the birth certificates actually went to the schools, or they had like big campaigns at the school where you could come and register your child or whatnot. I'm not sure about all the details, but what I do know is that they massively increased birth registration in a very short period of time, working very closely with Ministry of Education. So there's some really interesting and good ways to do that. And again, you just don't want to marginalize anyone or prohibit education, but if you can kind of make it compulsory and help people make that next step to get a birth certificate who don't, that's a really good way to improve birth registration completeness. So thanks for that comment and bringing that up. Any other thoughts or comments before we head into our next exercise? I'm going to share the Word document, and we'll just keep doing kind of similar what we were doing before. Looking at exercise 6. So if, again, this is on your Word drive, or sorry, your Google Drive. It's getting late here. So we're looking at exercise 6, question 1, and now we're talking about birth registration. So Poplandia would like to look at birth registration completeness by mother's age and ethnicity to see if there are sex differentials in registration. So if you remember from the lecture, we said we were going to look at this as part of our exercises. So here we are. So we're assuming that data quality is acceptable. There isn't anything too crazy going on. We trust our data. What do the following results mean? So here we have our graphs by, we have mother's age, and then we have Indigenous for the males and the females, and the Marsian males and females. And just in case you want the actual numbers, because some of these are quite close, there's a table down below, and you can look at the actual numbers of birth registration completeness. So I'll give you a couple of minutes, have a think, look at the table, look at the graph, and why don't you post on the Jamboard, what do you think the following results might mean? So colleagues, while you're having a think about what the data means, I've also created a quick poll, which is something that I was hoping you would also be thinking about. So when you look at this data, is there a sex differential in registration? Do you think males are more likely to be registered than females? So also the polls in the chat, and also it should have popped up here as well. So have a think about that. Yes, no, I don't know. So when you look at the data, do you see any kind of sex differential? I'll give you maybe 1 minute to respond and we can discuss. Okay, if you haven't already, just take a minute maybe to vote on what you think about sex differentials. Do you think males are more likely to be registered than females? Do you see that in the data? Yes, no, or I don't know. And then when we come over to look at our Jamboard, so it looks like across the board, a lot of people mentioned the disparity in the Indigenous group. So we definitely are seeing lower rates of registration among the Indigenous population. I'm going to read this green one down here. So Indigenous group is low in the age group 15, 19, 20, 29, again being age 39. Generally no difference in sex. And then up here, you notice that the male Indigenous children are let's see, more likely to be registered. Marzians have higher proportion. There isn't much difference in male and female. Okay. So let's see, what does our poll over here say? So it looks like 88% don't think that there's a sex differential, 11% do. Let's go back and look at our data together. One more time here. Okay. So and we were looking at our results in terms of ethnicity, mother's age, and sex. So we already know that, you know, there's lower rates of registration for these young mothers, particularly among Indigenous mothers. We can also see across the board, Indigenous mothers have lower rates of registration. But when we look by sex, it's very close, you know, across all age groups and between both ethnicities. And then if we go look at our table, it only varies by, say, 1 or 2 percentage points. So these are very, very close. And sometimes, you know, the female is actually higher than the male. So in this case, given this data, I would say there's actually no sex differential going on, which is good. You know, that's not something that we have to worry about. But what we would want to focus on then, you know, we're kind of worried about the disparities between the ethnicities and then also between mothers' age groups, which a lot of you mentioned in the sticky notes. So I think we're all on the same page here. So the next question is, let's think about the policy implication of these results. So if we are saying that there's no sex differential, but we notice some other disparities in our data, what are the key policy implications that we should be focusing on? So going on to this question here, I'll give everyone a couple of minutes to think about it and maybe post your thoughts on the Jamboard, and we'll circle back. I see a hand raised from a colleague in Bangladesh. Do you want to go ahead and speak? Please feel free. Hand down. Just kidding. Maybe it was a mistake. So maybe 2 more minutes, but if we can think about our marginalized populations are our young mothers and the Indigenous population. So what could we do to improve registration for young mothers? Or what could we do to improve registration among the Indigenous population? You know, what kind of efforts could we make to help those particular populations improve registration of births? So have a think about that and kind of like a brainstorming session and think about some factors that might have affect them and what might need to be done in order to address these factors. Okay, great. I see some more comments. I like the comments I'm seeing. So, you know, conducting mobile registration to these areas. So especially for the Indigenous population, if they're remote or they don't have access, yes, absolutely. Awareness, especially to young and older Indigenous mothers on the importance of registering births. Yep, absolutely. If they are geographically isolated, then the need to decentralize health services, make them accessible. Yes, so if remote access is an issue, we need to find ways to reach them. Absolutely. Let's see. Over here, I see something about maybe linked with subsidies. So that's, yeah, one way that registration has been improved. If maybe you get quote unquote baby box if you register the birth, or you get some free diapers or formula or some, you know, even little incentives like that, or other financial incentives can help improve registration. What else did we have here? Establish more offices, absolutely. So if there's a remote issue, you know, there aren't offices in certain provinces or districts or areas, then yes, we need to increase access among the Indigenous population. And so I see a couple of comments about compulsory birth registration for both ethnicities. You know, I didn't specify in the country of Poplandia the situation, but in a lot of countries, registration is compulsory, but people still aren't doing it for whatever reason. So there's still some barriers that need to be overcome, whether it be, you know, cost or access or awareness or whatever it is. So sometimes compulsory isn't enough. It's a good start to have that legislative framework, but sometimes there's other things that need to be put in place in order to reach that goal. Let's see. Yeah, so you know, there was a comment somewhere, I can't remember where, I don't see it now, but you know, talking about school, you know, that's a good place to check and see children having birth certificates and trying to support families who may not have one at that stage. Okay, so going back to our exercise, we're going to skip the next question about, you know, I had a question, is any further investigation needed? My comment here was just that, you know, that this particular inequality assessment didn't find any sex differentiation, which is good. But that doesn't mean in the future you shouldn't examine it. So the recommendation is to check back again in, you know, 5 to 7 years time and make sure you still have the same finding. And that would also help substantiate your findings. But at this point in time, it doesn't make sense to use your resources, which are limited, to educate people and improve differentiation between male and female births. It's more important to bridge the gap between the ethnicities or between the young or the older mothers. So let's go on to the last question. Well, actually there's 3, but the question 2, the also referenced in the PowerPoint. So Populandia also performed analysis by province and ethnicity of birth registration completeness to better understand if geographical location, access, or ethnicity was affecting registration rates. So they wanted to know, is it just about remote access, or are there other maybe cultural factors playing into registration rates? So within provinces, do we see a difference in ethnicity birth registration? So based on the figure below and the map underneath of registration offices and locations, what can you say about birth registration completeness and ethnicity and/or access? So here's their findings by province and ethnicity. And then again, here's the map that you saw from the lecture, similar thing in terms of where the registration offices are located. And so, you know, for example, if you looked at the Eastern province, and do you see a difference between ethnicity? So is the low rates of registration, is it just access issues, having no offices, or are there other maybe cultural factors playing in? So have a think about that, look at the map, look at the graph, and then you can post your thoughts on the Jamboard for question 2. So when you're looking at this data, when you're looking at the province by ethnicity and also thinking about where the registry offices are, have a think if do you think that the low rates of registration in the Eastern area, is that just about access, about not having offices? Or is ethnicity also playing into this as well? And one way to look at that is to look at within a province, is there a difference in registration rates between ethnicities? And if there are, then there's probably other factors besides just access that is playing into this. So look at maybe the country holistically and then by province, and think about what might be going on. And you can post your summary in the Jamboard. I'll give you maybe 1 or 2 more minutes. Okay, so far the comments that we have are access is an issue. So we're definitely seeing that the provinces that don't have registration offices, access is an issue. We're seeing lower rates, right? So low birth registration of Indigenous population is an issue, yep. And then the Marzians have perhaps it's an awareness issue. So maybe there's something going on culturally between the two ethnicities that Marzians are just more aware of the need to register. That could definitely be a possibility. So you skewed the number of registrations. Yep, so this comment about the Eastern Isle needs more registration units. Yeah, it's an access issue. And then, yep, there's lower registration in the East. Okay, so let's have a look at the graph again together, and kind of walk you through what we're getting at here. So, here's our map, and we know that there's no offices here, so we know it's going to be an issue. But if it was purely an issue of access, if it was registration is low because there just aren't access to offices, what we would expect to see is that both the Marzian and the Indigenous population had similar rates of registration. Say they both are at 50%, or they're both at 60%, or very close to each other. But when we go up to our data and we look at Eastern or Eastern Isle, we don't see that. So Indigenous is almost half of what Marzian is. So 45% compared to 80%, 40% compared to 60%. So what that tells us is, yes, there's definitely an access issue, and there's access issues for both ethnicities, but there's something else going on. Because if it was just access, these would be the same. They'd both be at 45 or they'd both be at 40. But there's also some cultural factors or something else going on because there's a difference between ethnicities. So that means that we not only we need to build registration offices and provide better access, but we probably also need to do some better targeting. Perhaps it's awareness, or maybe the Indigenous population is disadvantaged. Perhaps they don't have the necessary paperwork or identity documents to register births. There could be a number of factors going on. And so similarly, when we look at the capital, if we go down here and we see a lot of offices in the Western province and the capital, and so we would expect access to not be an issue, in which case we would expect, again, similar rates of registration and then those rates to be very high. So they are high for the Western and the capital, but we still see a differential between ethnicities, with Indigenous lower than Marzian. So Marzian is nearly complete and Indigenous is a little bit lower. So this again tells us there's probably some kind of cultural factor playing into what's going on, why there's lower rates of registration, and we would need to address that. So at this point in time, we don't know exactly what it is. We might need to do further research. But what we do know, it's not just purely an access issue. There's something else going on as well. So I wrote a little bit of notes and summary here. You know, I'll save the quote unquote answer key to the Google Drive, and you're welcome to go back later and have a look and read my summary and have a think again, looking at the graphs. Let's see if we mixed. I don't think we missed. So then I think we'll just do one last question. And so if we think about, well, actually we kind of talked about that already, so maybe we'll skip this, but what are the policy implications? So again, the intervention would focus on building registration offices for the access, but it would also focus on how to bridge that gap between the two ethnicities, how to bring the Indigenous completeness of registration up to a similar level of the Marzians. And so if there's any further investigation in this area, we would need to understand why the Indigenous population has lower rates of registration. Is it because they don't have the paperwork they need to register? Maybe they don't have their own birth certificates or marriage certificate. Is it an awareness issue? Are there barriers such as the cost of transportation getting to the office or the cost to register to get the birth certificate? Each of these things have their own policy implications, so we need to better understand which exactly is kind of driving the differentials in order to improve the situation. So I'll pause there. Let's see, we have what would be the proportion of population of both ethnicities in Papua-India? I mean, I didn't specify the proportion, but in this way, it doesn't really matter because your numerator and your denominator is going to match. So if you're looking at Indigenous population, you have Indigenous registered, Indigenous estimated. Same with, say, Marzian registered, Marzian estimated. So whether it's 5% or 50%, because you're aligning your numerator and your denominator, it's, that's not going to skew in terms of your completeness. So I didn't actually specify the proportion of the population in this example, but let's say they're roughly, say, 40% and 40%, just for the sake of the exercise. So any other perhaps comments or questions thus far? Okay, if no other comments or questions, we will go on to our final lecture of the day, talking about how to determine data reliability. We just finished exercise 6 and now we're on lecture 12. So comparing our data to other sources, graphing our data over time. The best way to understand if our data and our results are robust is to compare them to other sources or the same data that is collected over time. So again, that's why we looked at the Ministry of Education, say enrollment data over all those years, or registered births over all those different years, or recorded births, etc. So we want to understand over time. But we also want to understand completeness over time. Unfortunately, inequality assessments are relatively novel undertakings, and there's often not a lot of disaggregated data or other sources to compare to, especially when you're looking at death registration completeness. At least for births, perhaps you have the mix every, say, 5-7 years or whatnot, or the DHS, that might disaggregate for some populations, but your data is a little bit more sparse for deaths. So one thing that you can do is to evaluate your data at the national level and compare it to other sources. And if you see pretty, like if all of the different sources triangulate towards the same values, then you should feel more comfortable about your data being robust enough at the national level to disaggregate further for your inequality assessment. So in this example, let's say that we found that 80% of deaths were registered at basically at including delay, and then 75% were registered within a year. And this is at the national level. So what we might do is compare our estimate to some other sources. And again, we could look at some other options for our denominator. So our numerator is always our registered deaths, but perhaps we could use something like the crude death rate from the World Bank or the UNWPP to estimate the deaths, and say that we get, roughly 700,000 or whatnot, and that gives us 79% completeness, which is pretty close to our estimate here. Or say that we looked at the Lancet Global Burden of Disease. Sometimes they also provide death estimates for certain years for most countries in the world. And if we use that and say we got something similar around 700,000. So we looked at 3 different sources and they all kind of triangulated around the same number. And that would make us feel a little bit more confident about our results at the national level. And we would then look at our data over time. So in this example, we have registered deaths in Papulandia by age group and all these different years. And, there's some noise going on here, especially in the, 50 to 70 year range, but we see a very similar shape over time. And then the years that are lower here are, so we have 2010 and 2011. And then things seem to go up. So that could also be that perhaps registration improved or whatnot, but at least the shape of our curve is pretty similar over time. So we are comfortable with that. Are our data consistent with time? Again, looking at by sex. And so these are graphs that we saw before, but they're important to just discuss again. And we like that we have very similar shapes between male and female. This is good. And then here, between ethnicity, things were, relatively okay until about 2016, and then something happened. And perhaps that could also be what we were seeing going on with our data when we saw there were some issues with completeness for the Marsians or some other things going on. Perhaps there's some coding issues. And so in that case, we might pause our analysis for ethnicity and go back and check and see, review some of the data quality issues and find out what's going on before we draw too many conclusions. And we compare our data to other sources. So in this case, we have our recorded deaths from the Ministry of Health, and then we have the registered deaths, and we see a very similar pattern and shape, and they mimic each other, which is a sign of good data quality and makes us feel more comfortable about doing our analyses. Again, this is looking at the 2 different sources. So you have your registered deaths, and then you have your Ministry of Health deaths. We see a very similar pattern. again, we can kind of see where the gaps are. We can see that we're missing these under ones, and we're missing a chunk of kind of late middle-aged people. But the shape is very similar, so we don't see anything too aberrant between the two sources. But let's say that we actually do have some more information, particularly in the case of birth registration. So in this fictional example over here, let's say that there was a mix in 2013. We did our analysis on the Ministry of Education data for 2014. Let's say that there was a census in 2015 and a DHS in 2017. And each of these dots represents the estimate from each of these sources. And then the orange line is the Marzians and the green line is the Indigenous population. And then if we just kind of looked at the trend over time, that's what this little dotted line is here. Which, if we look at it, it looks like it's pretty flat, maybe slightly improving, but not by too much. But also we can see that all of our estimates, perhaps aside from the census here, they're all within close range of each other. So if we were doing our analysis based on the Ministry of Education data for, say, 2014, and we are comparing them to similar years, we would feel pretty confident with our analyses because our estimates are very close to estimates from other sources. And so nothing too shocking or worrisome is going on over time. However, let's say that maybe we have a different estimate. So this is just another example. Let's say that our results were 89 and 99%, but years that were close by were quite a bit different. There was almost a 20% different here. So these little black dots, let's say that this was our inequality assessment, but then other results from, say, the mix or maybe the census or the DHS were quite a bit lower. And then if we kind of look at the line over time, it looks like we're way off base. And in that case, this might make us question our results. So why are ours so different from the other ones in similar sources over time? When we get implausible values, we have to think about, okay, what do we do with them? What do we do next? So if you recall, I believe it was yesterday, we talked about this year 2018 and some of these deaths. And actually, if you were first seeing this data and you kind of see everything clustered together and there's a little bit of a pattern, especially at the beginning and the end of the year, but then you see 2018 and you have this, and you start to wonder, but then sometimes these things can be explained, right? So we said that there was a big cyclone in 2018 in February. It killed a lot of people. And perhaps this is a resulting delayed impact of that cyclone. Poor sanitation, people injured in hospital who died a month or two later, et cetera. So when we have aberrant results, we need to do some research. Perhaps there was a policy or an event or some kind of cause that could have resulted in the data. Whether it be improved registration or greater number of deaths or whatever it may be, perhaps it's explainable. And if that's the case, it's just important that we highlight that reason in the text so our readers and our audience understands what these results mean and why they're there, and actually that they're accurate, and you can kind of back up why that estimate may be different than other similar estimates from other years close by. But if perhaps the explanation is actually because of poor data quality, maybe your data wasn't complete. We looked at that over 100% completeness of Marzians in the 1 to 4 year group. Maybe something is misreported or just, there's data issues that you really can't solve. So you have a couple options. If it's not too terrible or you think it's still helpful, you can still publish your results, but you do need to caution the reader about the low value and some of the possible data issues and the causes for this. So in this case, it would be helpful to publish your results alongside other estimates. So the graph that we just saw with the census, the DHS, the mix, et cetera, alongside each other, so that readers can kind of understand where your result lies compared to these others and interpret them correctly. If this isn't so much for the inequality assessment, but say that you want to go on and you want to use your data to do fertility or mortality indicators, it might be necessary to adjust your results before putting them into something like a life table, because you don't want to give misleading measures or mortality indicators. In that case, you would just need to mention that you adjusted them and how you adjusted them. But if your data is really poor quality or something really strange is going on, it's completely okay to say the data was not robust enough for analysis and that more research is needed. And this is actually a really critical component of inequality assessments. So you can highlight the things that are not known, maybe what research needs to be done, or you can highlight the data quality issues that you do know, so that going forward, the data collection can be strengthened, more investigation can be done into some of the problems, and understand, why you might be seeing some of these strange issues, such as 140% completeness in certain age groups or ethnicities. So with that, take a minute if there's any comments or questions before we have an exercise on comparing our results over time. If no questions or comments, we will go to our exercise 7. Let me just zoom in on it before I share it with you so we can look at it together. Okay. So we're now going to look at another country. There's a nearby country of Utopia. So as another exercise, let's look at the nearby country of Utopia and assess the quality of registered birth data. We have registered births from the Civil Registry for the years 2015 to 2021. So these are registered births, and each of these years, each of these colors represents a year, and we're looking at the number of births by mother's age. So the question is, looking at the graph above, what do you notice about 2015, which is this red period, going to 2019? So going kind of down the rainbow here, what do you notice? Let's see here. Maybe let's just start there. This is a pretty quick question, so I'll give you just maybe like 2 or 3 minutes, and then you can pop your thoughts in the Jamboard, and we'll kind of walk through this example. Why don't we talk about actually on the same Jamboard, part A, part B, and part C. So what do you notice for 2015 to 2019? What happened in 2020, and what happened in 2021? And so I'll try to set up the Jamboard so that maybe we can have 3 columns, and we can just comment on the part A, B, and C in terms of what you're seeing in this graph. So give me a minute, I'll set it up, and we can go at it that way. Okay, so it looks like a number of you have really hit the nail right on the head. So you mentioned that it looks like the births are decreasing, or maybe the fertility rate is falling from 2015 to 2019. But then something's going on in 2020, likely an impact of COVID. And then in 2021, so some people have noted there seems to be a baby boom. Another note was, it's not a data quality issue. It could be about like delayed registration, etc. So let's just look at the graph together real quick. Okay, so we do see that the red going down to the blue, registered births. So if we take those to be relatively complete, it does seem like births are falling over time. The shape of our curve isn't changing too much. So over time, maybe we would expect there to be some shifts in age or whatnot, but this is a pretty short period. It looks very similar. We're happy with the data quality of this. Then enter 2020. So the shape of our curve is, fairly similar, but it's quite a bit lower. So there's a big gap here, and that is probably an impact of COVID. So you're right. There's probably something to do with delayed registration or something is going on. And then enter 2021. So the thing with 2021 is it doesn't, the shape is not quite the same. It's a little bit skewed, and it's definitely the highest year thus far. So in a country where it seems like the births were going down each year, all of a sudden it goes up. And so there's probably a couple of things going on. I didn't really specify in terms of delayed registration of the graph, but it could definitely be that those births that occurred in 2020, there's a delayed registration. But the other thing is that there were some countries that did see a little mini baby boom due to COVID and the lockdown. So it looks like this might be the case. And one of those things, you especially see it in the childbearing years, say 20 to roughly 35, the most here. And so, part of that could be that there wasn't a big change here because there wasn't a lot of opportunity. If you're in lockdown, you might not be able to leave. And then the older age groups, perhaps, perhaps the biology plays in more than, the opportunity of the lockdown and COVID and the baby boom. So it's probably not a data quality issue, but that doesn't mean that we shouldn't investigate and ask a few questions and try to understand what is going on. And then the other thing that we would want to check is following 2021, what happens in 2022 and 2023. We would, in theory, expect to see the births drop back down. So everything was kind of decreasing. We would expect to see 2022, 2023 somewhere in here. We wouldn't expect the baby boom to continue. And if our data going forward kind of matches that pattern, then we would feel fairly confident about its accuracy in using it for analysis. Okay, so the next question here is we're going back to Poplandia, and the country wants to use the 2015 census to estimate births in their denominator. However, they're unsure about the data quality of the census to do this. So they decide to plot the census births by mother's age against registered births, and then also the births estimated from the Ministry of Education school enrollment data for 2015. But if you recall from our previous exercise, I believe we did yesterday, the school enrollment data was only 50% complete in 2015 by ethnicity for the Eastern Province. So if you recall, 2015, it had some problems for the Ministry of Education. So here is our graph for these three different sources. And this one as well. So what do you see in the charts above? So both at the national level, but also by ethnicity and mother's age. So have a look at the figures and what do you see, and maybe think about the usability of these for, let's see here. So, do you think we can use this going forward for the analysis? So maybe just take a couple of minutes and have a thought about what you're seeing in the graphs, and you can pop a comment in the jam box. I see a comment about the graph labels are not clear. The index of the graph shows same thing for 3-line graph. I'm not sure I understand. Let me look at it again. Do you maybe want to explain the issue with the labels? I'm not sure what you mean. Maybe let me let's look at it together. So what we're looking at here, this is for the Indigenous population. And so the blue right here is the civil registry, the registered births. And then the orange is births from the census, estimated births from the census. And then the gray line here is based on school enrollment data. So all three of these are specific to the Indigenous population, but they're from different sources. So this one is from the census, this one is registered births, and then this one is school enrollment data. And then similar, this is your Marzian population, but the census and the registered births are almost on top of each other. They're very, very similar. And then the school enrollment data is down here for the Marzians. I'm not sure if that helps clarify the graph issue.
Renee, I was just looking at the exercises in Google Drive, and in the graphs there, we don't see the labels the way they are on the screen right now. It just shows Marzian and just shows Indigenous for all three colors, but doesn't say the data source, etc. So maybe that was the confusion.
Okay, so I'm sorry about that. Probably there wasn't the latest version in there. So maybe this, I'm looking at the one with my answer key, so it's slightly different. So apologies that you're missing the labels. So I won't expect you to be able to interpret too much without any labels. That would be confusing. So if we look at just my picture here, and we're looking at these three sources here. Just based on what you're seeing, maybe we can just have a quick poll. So do you think the census data can be used for estimating births for an inequality assessment? So you can have a little vote. It's also in the chat box. Yes, no, I don't know. Okay, well, maybe in the interest of time, we'll no one's voted yet. We'll hold off on the vote, but I do see that there are some comments. So people are saying that there's similar trends. You know, the census looks similar to the registry. So that's good. And that would be encouraging to us to use the data. So here, you know, we see the census and here is the registered births, and it's a similar shape. And of course, we would expect to see, you know, the registered births might be lower, especially for the Indigenous. And the fact that it doesn't match MOE is okay because we know that there was already a problem with the data from 2015. And so similar with the Marzian, the fact that the census and the registered births align very closely, and we know that Marzian registration is pretty high, then we feel pretty good about the shape of this curve and that we could use the census data for analysis. And then we aren't too worried that it doesn't match the Ministry of Education because, again, we know that there was an issue with other parts of that data. So we just have a few minutes left. Maybe what we can do is just, let me actually, so what I'll do is I'll stop sharing this one. And I will, let's just quickly look at the last exercise together. All right, so if we looked at this question 3, let's say that Papulandia has the opportunity to perform an inequality, it's supposed to say inequality. Let's see here. Change that. Assessment for birth registration by ethnicity each year. And the graph below shows the results as well as the trend line over time. And so if we look at this graph for here's your Marzians over time, and then here's your Indigenous over time. Do we think that the data is of good quality? Why or why not? And the other question that we want to know, what is happening in terms of improving registration really for either population? Is there improvement going on, or does some more work need to be done? So looking at this graph right here, I'm going to put up a quick poll for everybody here. Okay, so it's loading, the poll is, but have a look at the data and see what you think. Do you think it looks reliable? Do you feel pretty confident in using it to make assumptions and to inform interventions to improve registration? So we have 1 yes. 2 yeses. 3, all right. The yeses are winning so far. 5. 6. Okay. So yeah, it looks good, right? So 9, wonderful. 10, okay, great. So we're all kind of on the same page here. We don't see anything too crazy going on. It looks like, maybe it was a little low here, but then it went up, and maybe that actually there was some improvements or, targeted campaigns or whatnot. But the question is, what is happening over time? So if we feel, pretty confident with our data, it seems like it's forming some kind of trend, but actually the trend is very, very, very slow, gradual improvement, almost stagnation. And so that might not really matter too much among the Marzians because they're very close to complete registration. But in terms of the Indigenous improvement, we aren't seeing a lot of it. And so it looks like there's still some work that needs to be done for that particular population. So, what you would want to do is use something like this to advocate for more interventions and more targeted policies and resources to support the Indigenous population to register their vital events so that we see better and greater improvement over time. See, so we're now up to 18 yeses. Fantastic. Okay. So we're at time for today's session, but I want to give the opportunity if anyone has any comments or questions from the lectures or the exercises thus far. Please feel free to speak up or put it in the chat box. No, it looks like everyone is ready to go to lunch. So If no comments or questions, feel free to add them later. And otherwise, we will see everyone tomorrow at the same time, and we'll start discussing how to write up our results for policymakers, and also to make sure we can put in place interventions and that our data is actually being used for the purpose that we're doing these exercises for. So thank you so much, everyone, and we will see you again tomorrow. Oh yeah, so Panita just put in the chat, there's a workshop webpage. So feel free to have a look, and I think that the lectures are being recorded and the resources are there as well. So thanks, colleagues.